And we are now live.
Good morning. This is Senate Health and Welfare Committee meeting, and it is January 11th, 2023. So welcome, everyone. This morning, our agenda's been sort of changed, and that you have a fresh copy on your desks. We'll spend just a few minutes talking about committee priorities, so each of you maybe give one or two of your thoughts, and then we'll come back to that discussion at 11 o'clock. We're trying to accommodate folks who have other schedules. So we'll start with that. We'll just dive in and talk about what maybe your major goals are for bills or issues. So just speak to a specific issue, and then we'll go from there. We'll come back to this, as I said, at 11 o'clock today, and we'll come back to it regularly during the committee process as we get bills up on the wall. Priorities change, interests change, and we want to make sure we're staying current. So Martine, I'm going to start with you. Senator Bullock.
Let's see. Okay.
Very, just a brief couple of thoughts about your interests.
Well, I am bringing the thoughts that came out of the Burlington and Winooski meeting that you were at as well. I just thought I would share those because they seem really relevant to my constituency and just relevant in general. One of them, and I'm not exactly sure what this would look like, but one that got brought up was specialized care for violent individuals. You probably remember that. Improve access to medication for opioid use disorder.
Mm-hmm.
Contingency management for the growing meth use that we see, especially in our urban areas. Reentry support for justice-involved individuals with substance abuse disorder. Expanded residential treatment opportunities, including long-term residential treatment for mental health. This is a huge part of a lot of what I'm talking about today, and I'm sure
You are. You're sort of going both in and out of the public safety realm.
Yeah.
Yeah.
Right. As it pertains to mental health and drug addiction. Just a few more. Removing barriers to overdose prevention sites. I'm very interested in shield laws. Reduce and streamline prior approval process with insurance.
So you're talking about prior authorization?
Yeah.
Yeah.
I keep hearing that from our medical professionals.
Yeah.
And I really would like to learn more because I keep hearing about the guardianship issue.
Mm-hmm.
I would like to learn more about that, and I think maybe something that we want to try to fix. It seems like it's has some problems. And then lastly, I think there are already some bills that are being drawn up here, so I don't think I'm going to necessarily, but given that we are having this mental health crisis, I think we should look at legalizing therapeutic use of psilocybin. I think it is proven to be very helpful to folks suffering from PTSD, especially veterans and folks who are retired from the military, as well as reducing anxiety and depression. So those are mine.
A short list. We should be able to tackle all of those in the first, I don't know, next week. There are some very important issues in there. Thank you. That's a good list.
Thank you.
Okay. Senator Hardy, do you want to go next?
Sure.
All right.
Well, I think I would agree on pretty much everything on Senator Bullock's list. I'm on the opioid settlement advisory committee, so I've been working on substance use disorder legislation. I have a meeting today actually with Commissioner of Health later to try to tease out a little bit more about what he's thinking. So I'm working on a couple bills on that are coming out of the work from that committee. And also work we did last year that was vetoed. So that's great to hear that you're interested in that. Senator Lyons and I are working on a protective healthcare bill, which would be essentially shield laws, both from the health and welfare stance and the judiciary perspective.
So
We have a lot of it.
we have 11 people. Our quota is 10. So I'm going to ask, and if you're sitting in a seat that's labeled staff, I'd like for you to allow for Rachel Feldman to please take one of those seats. And then that's it. Now we're right down to quota now. Oh, good. Yeah, thank you. Maybe let Rachel sit there. That'd be great. Okay, sorry for the interruption, Senator.
No, you're fine.
Okay, good morning, Senator Weeks.
Good morning. I'm not sure if you can hear me.
Okay, so we're just going through a short list of priorities. We've got only 5 more minutes, and then we're going to come back to our priorities at 11 o'clock.
Okay, very good.
Okay, terrific.
No, that's totally fine. So the protected healthcare bill, which would address shield laws from both the health and welfare and the judiciary perspective for abortion care and gender affirming care. Of course, childcare and early childhood education that we've been working on for a long time, and some follow up to some of the work that we did last year on healthcare reform, sort of an oversight, particularly right now with the meltdown of our ACO, and really trying to get a better handle on the future of the ACO and whether or not it should be a thing.
Can you share any acronyms?
Oh, I'm sorry, yeah. The ACO is the Accountable Care Organization, OneCare. Yeah, and I'm sure we'll go into more depth about that at some point. And certainly mental health. We did some work in mental health last year. Peer support and primary care and shoring up our primary care, and I will have bills on that as well. So, I also am reintroducing the bill that I introduced last year that we never got a chance to get to on fertility care.
Oh, good. Okay, right. And I know there's interest in that one too. Yes.
Yeah, and I can't remember what else, but those are the things that come to my head right now.
No, that's helpful. That's very
Yeah.
good. Okay. So, Senator Williams, why don't you give us a thumbnail, and then we will come back to this discussion at 11 o'clock and when we have our staff here. So just to give us a start would be helpful.
Okay, I can be very brief. One concern I've got right now is Medicare change for retirees. I'd like to know more about that.
Okay, good,
I
yeah.
have a lot of feedback from constituents.
You're talking about the Advantage Plan
Yes.
issue? Yeah, that,
Sounds like it's a done deal, but I'd like to find out if it is.
it's not.
Done deal.
It's not, it can't be a done deal. Just, I mean, so you, as you talk, we can talk about that.
Okay. And then going, the guardianship issue, I have a bill, I just need to get the legislative council with it. Basically, there are 2 different systems. There's voluntary guardianship and involuntary. There are, one is in probate courts and the other one is in the superior court, family court.
Mhm.
And there's 16 differences between the 2 types of guardianship. So this has all been being addressed by a constituent who has a concern. And it's not just his situation, but it could affect anybody who has a parent or a child that they could apply to. So it's an interesting subject to me.
Yeah, it is. I mean,
Very-
you're talking about guardianship, not just of children, but also adults.
Correct.
So adult protective
Yes.
services, yeah, okay.
And that's about it.
That's good. That's enough. We'll find more. Okay, good. Senator Weeks, would you like to just give us your initial thoughts? Go
Yes,
ahead.
so this is initial thoughts on the
On
product.
on your interests and your goals, the issues that you'd like to see covered in here as we
Right.
work together on legislation.
Right, yeah. So in addition to the ones that we discussed last week, I would simply like to add the issue of pervasive obesity. I'm curious if there's anything that the state can do about addressing the prevalence of obesity in our, specifically in our state culture. But that's the only new one that I thought of since we got together last week.
Okay, and are there any others that you're specifically, I know even bringing in what we talked about last week, those issues that you are most concerned about with maybe introducing a bill or you would like to get involved with?
No, the reality is that I'm not familiar enough with the bill process to be to be drafting at this point. That's the uncomfortable reality.
Okay, well, that's just fine. We'll get there and you'll have fun doing it. Okay, good. So everything that you all have talked about are things that I'm interested in and hope that we can work together on. Is Jenny Samuelson in the hallway? Do we know?
She's on the Zoom.
She's on Zoom. Oh, good, you're here. Okay, so I'll hold off and I can give you a thumbnail when we get to 11 o'clock. But I do want to make sure that the secretary has sufficient time to share with us the work of the agency, her perspective. So I want to just, how many people have we got in the room? Oh, we're perfect. Okay, good. We're good. So Secretary Samuelson, welcome to Senate Health and Welfare. It's good to have you here. You're our first official witness. Why don't you introduce yourself for the record? And our goal here today is to get an understanding of a little bit about the agency and the work that's going on there, and then where you see the greatest challenges for us as we work together during the session.
Well, thank you for having me, and it's an honor to be the person providing first testimony for you this year. It's been exciting to see the energy with having everyone back in the building, and I had been very hopeful to be there this morning, but having woken up with a scratchy throat, thought it was prudent to stay put. So apologies for not being in person. Again, for the record, I'm Jenny Samuelson. I'm the secretary for the Agency of Human Services and have been for the last year. I've worked with the Agency of Human Services, though, for the last 17, almost 18 years. So my goal this morning is to meet your needs. Please feel free, Chair Lyons, to interrupt and ask questions or other things as you feel fit throughout today. I'm going to start off with a general orientation to the agency and its departments. Then we'll drop into what our priorities are for the next year. And it's nice to meet all of you who are either new to this committee or who are new to the Senate.
Would you like for us to, I would like to have our senators introduce themselves because we have 3 new folks on the committee.
That'd be great.
So we're going to begin on the screen with Senator Weeks. Just your name and your district.
Yes, good morning. I certainly understand, Madam Secretary, how you feel about not coming into the room when your throat's a little scratchy. I got hit pretty hard with a cold last night, so I'm also remotely linked in. My name is David Weeks. I'm the freshman senator from Rutland County. I live in Proctor. Originally come from Wallingford.
It's nice to meet you. And I hope you feel better.
Yeah, me too. Thank you.
Martine.
Hello, I'm Martine Rock Julick. I am a new senator from the Chittenden Central District. I live in Burlington.
Hi, Secretary Samuelson. Nice to see you. Ruth Hardy from the Addison District.
Nice to see you again.
Voting Secretary Terry Williams, Senator from Rutland, and I'm from Pulte.
And Jenny Lyons, Chair of the committee and from Chittenden Southeast. Getting that straight. Okay, so do you have, I'm looking at a central office PowerPoint that we have on our webpage, and I'm thinking is that what we should be looking at as you're talking?
It is. It will give you kind of an outline of the direction that we're going today. Would you prefer that if folks either have it on their own computers or on hard copies, if that works better for you, or Rachel can share it on the screen? Which works better for you, Chair Lyons?
We have it on our screen. Committee, would you like to have it up on the why don't we put it up on the screen? And then we can take it down whenever we feel necessary.
Okay.
Go ahead.
Thank you, Rachel, for putting that up. Okay, and we'll move forward at least a slide. So again, the Agency of Human Services mission is to improve the well-being of Vermonters and to protect the most vulnerable. As you hear that, I want to emphasize that the breadth of our work goes from prevention and wellness, which I heard many of you talking about in terms of your priorities this morning, as well as working to support Vermonters who are oftentimes in crisis. The agency does our work by working with a significant number of community organizations and providers to administer a broad range of programs and services that promote both the well-being, as we talked about, of Vermonters, and to actually provide direct healthcare and human services programs. The agency really is dedicated to ensuring and working with individuals and communities to reach their potential. And I want to emphasize the last component. While we mount a significant number of programs and services, our goal really is to help individuals achieve a level of independence on their own as they move through our programs. You'll note that I wanted to make sure that we touched on the values and the approach to the work. Next slide, Rachel. The approach to the work that we do, because I think it's important as we work with you directly this year that you can see these come forward. There are many good things, probably thousands of good things that happen at the agencies. And then there are also some really hard things that happen through the work at the Agency of Human Services. But our value is really, whether we're talking about the positive or the challenges and opportunities, is to strive towards transparency and to do our work with integrity. We really have a strong focus on service, both for the individuals that we serve, but also service for the staff and other people across our agency, because many of our staff work internally as well as externally. So these should really come forward as we do our work together with the legislature. The Agency of Human Services also approaches our work with innovation, not just change for change's sake, but recognizing that over time, the needs of our communities and the needs of individuals are evolving. And so we're continuously looking for ways to ensure that we are looking for best practices and looking for new opportunities to serve people and to serve them well. throughout the pandemic, you have seen, or I have seen, and I'm hoping that you also have seen, the ability for us to come together and do teamwork. The Agency of Human Services is often talked about as having multiple silos because we are such a large agency. But what we saw during the pandemic is departments working closely together across organizational boundaries, and also more closely together with our community partners and with other agencies in state government. And so that's a true approach that we're working to hold on to and amplify. Many of the staff that we have across the agency could be doing work in other places that was less stressful or more lucrative for them, but they come to work with the Agency of Human Services every day because they're really dedicated to serving Vermonters and serving Vermont communities. And it's been a privilege to work with probably the most dedicated staff that I've ever worked with in my career and in my life. So for a general orientation, I know that we've got a mixed group, some folks who have either worked on this committee before or who are new to or new to the legislature. So next slide, Rachel. I want to do a general introduction. We are the largest agency in state government with a total budget of a little over $4.7 billion in terms of our appropriation. That is a significant mix across different fund sources, federal and state fund sources. We also have over 3,700 employees to carry out our work across our 6 departments and a couple of offices within the Secretary's Office of the Agency of Human Services. We do this work through 6 departments, and I'm going to go through each one of the departments and the general size and the mission of each. But I do want to point out that we recognize that oftentimes individuals will end up at our highest level of acuity in hospitals and our correctional facilities or through homelessness, but that the root causes of why they get there really are held within the jurisdiction of each of the departments within the Agency of Human Services. And so we really are set up by working across our boundaries to address mental health, substance use, trauma, violence, food insecurity, and housing instability that really, as we look further upstream, prevent these outward high acuity and expensive levels of care that cause trauma for Vermonters. So across those departments, we'll start with the Department for Public Health. It's the Vermont Department of Health. You'll often hear it referred to as VDH. It is our public health entity in Vermont, as you've seen over the last 2 years. They have a little over 650 employees with a focus on protection and improving the health of Vermonters. They do this through partnerships with schools, businesses, and communities. And the activities that they generally carry out include surveillance, education, promotion of healthy lifestyles, activities to prevent, detect, and respond to disease and injury from environmental factors and infectious disease. So they've got a significant breadth across the prevention spectrum, but also on the early detection and reaction. Moving forward to our Department for Mental Health, which you will hear sometimes referred to as DMH. They have nearly 300 employees, and they're really targeted to provide access to effective preventive and early intervention and mental health treatment and support to those who need it so that they can live, work, learn, and participate fully in their communities. They do this through a range of services, from prevention activities to community mental health services for people who need mental health supports, crisis supports and response, to intensive residential treatment programs, and then secure residential and inpatient hospitals. In order to do this work, they oversee the work of the designated and specialized services agencies in our communities. They also run Vermont's Psychiatric Hospital, which you will hear often referred to as VPCH, and a secure therapeutic residence, which at this point is in Middlesex, but will be moving shortly to the Chittenden County area in a permanent space in April. I want to note that they are, because of their work at VPCH and their therapeutic residence, and that they take direct custody of those who are in involuntary care, that this is one of our custodial departments. In addition to the work that we've talked about already, they have a range of partnership with other organizations and nonprofits, from hospitals to residential care to the crisis hotline, in order to carry out their direct mission. Rachel, can you move forward to, no, stay on this side, please. The next department is the Department for Disabilities, Aging, and Independent Living. They have approximately 320 employees. The focus of DALE is to make Vermont the best place in which to grow old or to live with a disability with dignity, respect, and independence. They do this by providing adult services such as Choices for Care, which are a set of community-based services that prevent individuals from needing skilled nursing levels of care, through Adult Protective Services and Adult Day. They also support care for individuals with developmental disabilities. They provide supports for individuals who are blind and visually impaired, and they provide licensing of long-term care and residential facilities, and support to individuals who may have disabilities and need employment, which is a really exciting preventive program, often which you will hear often referred to as Higher Ability Vermont. Like the Department for Mental Health, the Department for Disabilities, Aging, and Independent Living partners very closely with the designated and specialized services agencies. So you'll often hear the Department of Mental Health and Department for Disabilities, Aging, and Independent Living referred to when we're talking about the DAs, or the designated agencies. They work with long-term care facilities and the area agencies on aging, along with many other organizations, to carry out their mission. The next department is the Department for Children and Families. They are one of the largest departments within state government. They have almost 1,000 employees. They're focused on the health and well-being of children and families across Vermont. What folks don't often connect to them with them is that they also administer many of our economic services and supports, and that they are the ones who provide support for early education through their child development division. In order to do their work, that typically folks are familiar with their child protective services work, but they also administer 3 Squares, fuel assistance, emergency housing, known as the General Housing Assistance Program, or sometimes referred to as the hotel voucher programs. They support shelters and local offices of economic opportunity. They determine eligibility for disability services. They administer programs for child support. They do licensing for child care programs, and they determine eligibility and administer the child care subsidy programs. Moving forward to the Department for Vermont Health Access. They have about 374 employees. Their mission is to improve Vermonters' health and well-being by providing them with access to high quality and cost-effective health care. When most people hear the Department of Vermont Health Access, they think of DVHA and their role with the Medicaid program, but I want to pause there to note the role that DALE, the Department for Mental Health, and the Department for Disabilities, the Department for Children and Families, that they each oversee specific components of the Medicaid program themselves. As a whole agency, the agency is the Medicaid administrator. That said, DVHA plays a prominent role in the health insurance in Vermont. They help Vermonters access health insurance by determining eligibility and enrollment for Medicaid. They also run Vermont Health Connect, which is a place often referred to as a marketplace for individuals and businesses to purchase and acquire commercial insurance. They set rates and pay healthcare providers for healthcare services for the Medicaid program. And they also are driving much of the innovation in payment models and incentivize value versus volume in healthcare. So our last department is our corrections department. It has a little over 1,000 employees and is the largest department in the Agency of Human Services. I want to note that it is unique to have Department of Corrections within an agency of human services. And this really speaks to Vermont's commitment for identifying the health and human services needs that often lead to incarceration, such as mental health, substance use, and trauma. And as such, working to address those needs for individuals who are coming into custodial care and or community care through the Department of Corrections, really taking a therapeutic approach and a rehabilitative approach in the state of Vermont. And I appreciate that that commitment. The Vermont Department of Correction is committed to addressing these issues for those who are incarcerated or who are on probation and parole, with a goal that through the services and support that they provide, individuals will achieve independence and will not return to our correctional system. And Vermont stands out in that way. By being embedded in the Agency of Human Services, it provides them with a unique opportunity to partner with other departments across the agency to ensure continuity in the provision of services. They serve about 1,300 people who are incarcerated in 6 correctional facilities in Vermont. And it's worth noting that we don't have a jail system. We have a correctional system in the state, and that is embedded within our correctional facilities. In addition to that, there are 5,700 people, a little more than that, who are supervised in communities through probation and parole. So those are our 6 departments. In addition to those 6 departments, it's worth noting that, among other things, the Office of Healthcare Reform is embedded within the Secretary's office at the Agency of Human Services. I heard you talking before about the Accountable Care Organization, and it really is the role of the Office of Healthcare Reform to set the vision, direction, and policy related to healthcare reform, including how we evolve the way that we care, and then in support of that, the way that we pay. And the Office of Healthcare Reform takes a lead role in negotiating both with Medicaid and with Medicare at the federal level, the agreements and waivers that help them participate in Vermont's healthcare reform, and also to set the direction. As we look at where we are right now coming out of the pandemic, the Office of Healthcare Reform is really focused on 2 things: providing provider stability and long-term sustainability for our healthcare system. In order to make that achievable and doable, they really are focused into 4 key areas right now, including integration of mental health and substance use into our systems of care and integration with each other, looking at long-term care, or what others also refer to as skilled care, which includes our skilled nursing facilities and home health agencies, primary care, and then working in those 2 areas also with our hospitals, recognizing the important role that our hospitals play in the health and economic viability of our communities. And so there's been a lot of focus and a lot of work across agencies and within state government, but also with our healthcare providers to really focus on the stability and long-term sustainability of at least these 4 elements of our healthcare system. So I'm going to pause there, Chair Lyons, to see if there's anything, any questions that you or committee members have, and also kind of take a moment to take a breath before we head into our priorities that we have for the next year.
Any burning questions, committee? I think we're good. I think it's been very clear and helpful.
Great.
Why don't you go right ahead into priorities? I think you've got about 7 or 8 minutes left, and it would be helpful for us to understand what your priorities are and how they might dovetail with our thinking in here.
Great.
We'll sort that out as time goes on.
I'm sure we will. I look forward to continuing to work with this committee on that. So I do want to point out as we go into our priorities that the Agency of Human Services, while we play many roles, it's important to point out 2 particular roles. The Agency of Human Services is the Medicaid agency. So that's the public insurance program for Vermonters who have low income or a disability. And by doing that, we determine eligibility, we ensure payments and the provision of care for services for individuals who are enrolled in Medicaid. Across the entirety of the agency, and this should be a theme that and the Medicaid agency, it means that multiple of our departments are involved in administering the Medicaid programs and services. In addition to that Medicaid role, we also have a population health and human services role, really to assess and monitor the needs, the health and the needs of Vermonters, and to make sure that the systems who provide those services and support are appropriately sized and resourced, as well as making sure that those services are available to Vermonters. I want to reinforce that AHS facilitates these, the second rules through a significant number of investments in private nonprofit health and human services organizations. And we often do not directly provide some of the services in ourselves. We definitely determine eligibility and enrollment and provide case management. So when I look at our priorities for the next year and in this session, well, we've got many priorities. I want to point out three. We're really working on strengthening and integrating the system of care for mental health and substance use disorder. I want to point out the two components of that, really strengthening. So looking at the gaps, which you'll see and can see identified in some of our proposals for proposals and RFPs for mobile crisis alternative to emergency departments and implementation of things like the crisis call line. So real focus on making sure that we've got the right foundation across that whole system of care, and also recognizing the interplay between mental health and substance use and ensuring that that's a co-occurring system of care. The second is making sure that the health and human services works for individuals who are at highest need. What we recognize is that many of the people we serve come to us at a crisis point in their lives. They're enrolling in multiple services at the same time, and that there's a lot that we can do to ease the burden on individuals who are interacting with our system, particularly given the federal pressures that we have related to data and other things that we collect. In this area, you will see us working on both the flow within the Agency of Human Services through that collaboration partnership that I talked about earlier, but also through IT projects like integrated eligibility and enrollment, and continuing to move forward with that vision and direction. And so really looking at how we can also financially braid and blend funds so that that's not necessarily apparent to the client, but so that we can adequately support them and their needs. We also are looking to stabilize the health and human services system and do that with financially in a financially responsible way. Following the pandemic, we are continuing to pursue our long-term healthcare reform goals. And so in this area, what you will see is that there's a lot of workforce pressures on many of our the systems within the agency. We've been providing extraordinary financial relief, and we're beginning to look at with providers at how we might do shore up components of the system or do our work differently, given the fact that the demographic trends and others will continue to put pressures on our systems for years to come. And that also we need to make sure that we are that we continue to achieve our affordability goals for Vermonters for the services that they're enrolled in. So in addition to our priorities, there are some key pressures that you will see affecting the Agency of Human Services this year. Those include the updating the system of care plan and continuing to provide innovation in the space for individuals with developmental disabilities. As with many of our other systems, we're seeing a higher level of acuity and need coming into our developmental services system. And as such, we're needing to assess and reevaluate the programs that are necessary. The system of care plan will be provided or has been provided that provides some updates, but we also know that we need to look at our crisis system of care and some other innovations. We also are finding facility pressures. We have, as folks have heard, our women's correctional facility, looking at where that will be sited in place. Our high-end system of care for youth is experiencing significant pressures and significantly higher acuity than we have experienced before. And so looking at looking at where we might provide services to both provide immediate stabilization and treatment for youth who are in crisis. And then lastly, as we approach in the facilities area, we have seen an increase in the number of individuals who are adjudicated in the criminal justice system and need a hospital or a residential level of care and support as they're incompetent to stand trial and to really work towards competency. While I know that many folks may or may not be affiliated with this term, you'll often hear this referred to as looking really at our forensic system of care. And then lastly, housing. We've seen historic investments in permanent housing and housing opportunities across the state of Vermont over the last year. But we also see a significant need in terms of emergency housing needs and returning to a system where people get the care and support that they need if they are experiencing housing instability. And so really working with community partners to look at how we evolve from what our pandemic related position has been to something that is a more permanent solution that better serves Vermonters. And so those are some of our key pressures. Generally, I hear individuals ask when to contact the secretary's office or when to contact departments. And I think that here are some basic groundings. We have constituent services for individuals, particularly who are having a hard time across multiple different departments and or navigating services. Please reach out to the central office for that. We take press and communication inquiries that may also be pertinent to issues in cross departments. The Blueprint for Health and Healthcare Reform sit at the Secretary's office, as does our Office of Refugee Health and Resettlement. And so inquiries related to that should come to the central office. And then oftentimes there's multi-department inquiries. You know, where do we start? You're a large agency. Individuals are complex, issues are complex, they cross department boundaries. That's a time to come and talk to the Agency of Human Services centrally. And then the Agency of Human Services does our budget that we have across the entire agency. It's not departments. We try to look at it not as department specific budgets, but how we support the health and human services needs. And so agency-wide budget questions should come centrally to our chief financial officer. And then he has liaisons within each department who help administer the funds across those programs. So that's when to contact us centrally. And if you're trying to get a response immediately right away, Shayla Livingston, who's our policy director, and Ashley Roy, who is our administrative coordinator, and then you have Rachel in the room, are great contacts who often provide immediate response to questions and queries. I'm always happy to take them myself, but sometimes it may take me a day or so to get back, whereas Shayla, Ashley, and Rachel really catch things in an immediate way. So that's the agency overview for the Agency of Human Services in a nutshell. I'll turn it back over to you, Chair Lyons, to see if you've got any additional questions or inquiries.
Thank you. That has been a really terrific overview. And even for those of us who are experienced in this area, it was helpful to hear that and some of the nuance that you brought. So thank you. And thank you for staying within the time. It's terrific. I really appreciate it.
Yeah.
I know that there may be questions that I'm going to ask the committee. If you have a burning question for the secretary, could ask it now. Otherwise, we can move on to hear from Dr. Levine and the Department of Health. But do you have any specific questions? Ruth, go ahead. And Senator Weeks, do you have a question? Yes. No. Okay. Go ahead, Senator Hardy.
Thanks, Chair Lyons. Madam Secretary, you and I talked last week about the unwinding of the public health emergency at the federal level and the impact that will have on the Medicaid program. And I'm just wondering if you've been able to get any information on that. This may be just a reminder if you need to come back to us with that information.
Yeah, no, and we can dig that into more detail. For the other committee members, what we know now is that the public health emergency has been linked to a hold on redeterminations for Medicaid, which means that the Medicaid caseload or the number of individuals enrolled in Medicaid is higher than it's ever been because no one during the last 2 years has been redetermined at whether they're continue to be eligible. It continues to be my understanding, Senator Hardy, that in April that had been linked to the public health emergency and that we would not start redeterminations. It is still my understanding that in April they have separated those two things out. That regardless of whether the public health emergency continues, they will be able to begin redeterminations. That will have a significant impact on many Vermonters, but also the workload at the Department for Vermont Health Access. If for any reason I come back and we determine that that's not the case, and we're going to need to hold on redeterminations, I'll let you know.
Okay, I think it's mostly just what resources you may or may not need in order to do all the redeterminations and making sure people aren't falling through the cracks with that process.
Yeah, what we have done is that the Department for Vermont Health Access feels at this point that they've measured out the redeterminations over the period of time that the federal government will allow them to do in a way that is achievable through the department and achievable by asking other staff and employees and other departments to assist. And so right now they're feeling like they've got an achievable plan, but they'll know more about that when they begin the process to see whether they can keep on track with their current status and plan. It is a great question. It sounds like you have Dr. Levine coming in from our Department of Health next. I'm sure that some point during the year, you'll probably have Department of Vermont Health Access, but I will have Andrea reach directly out to you, Commissioner DeLabrio.
Great.
Thank you. No, and we will get to having a more direct and specific conversation, in particular about the results of the pandemic and the effects on not just DVHA but other parts of the agency. Thank you, Senator LaRock Lulick.
Thank you. Thank you, Madam Secretary, for that presentation. That was great. This also might be a question that we can delve into at another date, just because it may be kind of a big one. But I am curious about the need for a women's correctional facility, why there is a need or perception of a need, and also if there's a plan for that facility to be publicly held or privately. So if we could talk about that at some point, that'd be great.
Yeah, those are two easy questions to answer. So what, if it's okay with you, Chair Lyons, I'll go ahead and answer.
Take a half a minute. Go right ahead.
Okay. So our correctional facilities in Vermont are public facilities. They're run by and staffed by the Department of Corrections, and that will be true of the women's facility. Right now, our women's facility is in Chittenden County, and the infrastructure for that is aging. While they have looked at what it would take to address the needs, for example, some sewer and other related issues, it would be more expensive to do that at their current location than to build a more state-of-the-art facility.
Thank you.
That really helps to facilitate both incarceration and that gives them an opportunity to have community transitions approach, which is a state-of-the-art approach.
Thank you.
Okay, thank you so much. We appreciate your time, and this has been very clear. And I know that we'll be seeing bills that relate to some of the priorities that you've expressed. I know I haven't named my priorities, but one of them is Blueprint and also mental health and substance use disorder, and trying to integrate those co-occurring disorders into the programs that we have. So I look forward to having you back in or others back in as we discuss that. Thank you.
It's been a delight. Have a great day, everyone.
You as well. Take care. Dr. Levine, welcome.
Oh,
So, you know, we have a new committee.
I see.
I think everyone is probably knows who you are, but you don't know who we all are. So we're gonna go around the room yet again, and we're gonna begin on the screen behind you. And go ahead.
Yes, good morning, Doctor. My name is David Weeks. I'm the Rutland County Senator, and I come from Proctor. Nice to meet
Good morning, I'm Martina Rockula, I live in Burlington, and I'm one of the new senators from Chittenden Central District.
You know me, Ruth Hardy from Addison District.
Senator Terry Williams from Rutland District, and I live in Palmer.
I'm surrounded by Rutland. This is what happens.
Yes.
We're surrounded by Rutland. And I also know you, so it's welcome. It's great to have you back and have you here. Oh, we're interested in just getting to know about the Department of Health. Some of us are more familiar than others, and we have a PowerPoint. Are you going to go through that? Yeah, we have the Department of Health PowerPoint.
Yeah, so the way it was described to me, I could come back for
Yeah.
a broader presentation.
Yes,
And that's really the broader presentation.
this is the broader, okay,
But I also want to kind of satisfy your needs for today.
good. We really
So
want to get our
intersect
feet
with
wet and really understand the
Okay.
Department of Health and where the priorities are currently, the
Good.
work that you're doing and how we might be working together going forward. I know we're going to see bills on prevention, intervention, treatment,
Yes.
et cetera, so.
Okay,
Great.
so because there are actually more new members than old members, I think we'll start sort of at the beginning. Because I think one of the most common, if you will, areas that people confuse and conflate is healthcare with health. So I always try to begin with sort of understanding what health and condition public health are, because that's very different. I also want you to understand that the work of public health is broad and that we have a very passionate and skilled professional workforce to carry out much of that. Never enough, but still. Third, I guess, take-home message, if you will, would be that to work effectively, public health has to really work across sectors. We don't do all of the work of public health. It's really through partnerships and collaborations with legislators and governors, but also with all of the sectors of society, essentially. And that's where things like health and all policies becomes very important, because to have a healthy community, one requires interaction with Agency of Commerce, Community Development, Agency of Transportation, Agency of Agriculture, the list goes on. So those are sort of themes and take-home messages. The other take-home message is COVID is not our only business. Though it seems to never go away, it's still not at a level where we can't do other work. And that's really, I think, what we've arrived at of late. When it comes to, I'll say a few things from the slides, just to get us all on the same page. And then we can get into some of the priorities. But basically, the definition of health is really meant to be a definition that takes you off of the course of disease and illness. As a doctor, I try to deal with all of them, but at the same time, public health is really far more focused on the prevention theme, far more focused on mental, social, physical well-being. It's the state that we want to achieve. And that's really important. In public health, to me, our mission statement is really the reason to get up every morning and go to work. Protect and promote the best health of all Vermonters. And so that's what we try to do. which is not an easy task when you think about the spectrum and intensity of public health problems across the country, never mind in our little state. So I think that's a really important thing. The traditional definition of public health really focuses on preventing outbreaks and epidemics, working on environmental hazards, and trying to have healthy lifestyle choices to prevent chronic diseases, which, as you know, occupy the biggest part of the healthcare budget. The more modern definition doesn't ignore those, it encompasses those, but it also includes really working across sectors to achieve these common goals and have healthy communities throughout. And that's a broader definition, which I think is very useful to keep in mind. So with that as sort of the framework, the structure of the Department of Health has a number of divisions in it, some of which evoke the words I just used in the definition. So we have laboratory science and infectious diseases. Needless to say, that was intense during the pandemic, but there are plenty of infectious diseases to keep them busy, even if there were no respiratory viruses in the world. And there's plenty of laboratory work that's not all infectious. Much of it is environmental and in other spheres to keep our public health lab busy as well. But needless to say, the immunization section is under that, and there are more immunizations than just the bivalent vaccine for COVID. We also have an environmental health section, and this committee and others work very closely with that and us to achieve what we've achieved with school lead in the drinking water testing. They're also concerned about things like cyanobacteria, PFOA, PCBs at the schools, etc. We also have a section of health promotion and disease prevention, which I described earlier as how do we have healthier lifestyles, prevent chronic diseases, or enhance self-management of prevention of chronic diseases to have a healthier society. Opioids are always a big issue, so we have an entire division of substance use programs, but opioids is not their only business. Business is very broad, and we would not want to forget the impact of alcohol in our state. We would not want to forget the fact that teenage and middle school brains get affected by a host of substances on the way to some of the very bad things, not the least of which is nicotine, cannabis, alcohol. So big three. We also have a section on maternal child health. And maternal child health is exactly what it says. It's trying to keep that family structure as strong as possible in Vermont. From a physical health standpoint, from a mental and emotional health standpoint, from a substance use standpoint, from all of the things that cause what we call ACEs, adverse childhood experiences, that conspire in the very earliest parts of life to really set a child on its destiny, if you will. And the goal is that destiny be bright and wonderful and not severely restricted by some of the events of early years. So a lot of our work there goes on from very early life, prenatal, just after birth, to middle school, to high school, and to, again, involving the mother and family, whether it's breastfeeding issues and what.
You'll be happy to know that we have a proud new grandfather sitting in this room. So
I know the feeling.
Get a good note.
Good.
Yeah.
The other divisions would involve the newest one, which is health equity. And everything we do in the department is on a platform or a foundation of health equity, because health equity is so critical. The definition, if you will, is everyone should have the same fair and just opportunity to be healthy. And when we look at health data, which our department is all about, and we have an entire division called Health Statistics and Informatics, the data says that many Vermonters are doing just fine. But when you start to look at who the Vermonters are that aren't, you find that there are areas where there are severe inequities. They generally fall along lines of race, gender and sexual orientation, disability status, socioeconomic status. And a little bit in Vermont on rural versus, I hate to say urban, but rural status. So these are all really, really critical things. So that's kind of how our department is structured. And I'm sure we could talk for a long time on priorities. And I can do that when I come back, or we can start it today.
Well, I'm thinking that it would be helpful, I think, to have you come back, because I know there are a lot of questions that we want to dive into.
Yes.
And my particular interest will be to come back and have a discussion initially on prevention and the prevention council that's in place, the chief prevention officer.
Yes.
All the work that's been
Good.
going on for the past several years. And then how that intersects with the opioid substance use advisory committee that Senator Hardy is on, and how
Yes.
what recommendations we might be see
Good.
coming from there. And then, so yes, there's a lot just in that area. And Senator Weeks pointed out his interest in obesity, which is one of those problems that we see, particularly in adolescents. So some of us have been trying to work on prevention for too many years. And
Yes.
yeah, so what progress, if any, can be made? Adolescent issues are particularly have been really exacerbated during COVID as well as others. So
You've taken all the words out of my mouth that I would have come up with.
we would love to have you come back. I think that, that's just the tip of an iceberg, right? So,
Right, and there are some of those that are higher priorities than others, but they are all priorities.
they're all priorities.
And post-pandemic, they have become even more of a priority because lots suffered during the course of the pandemic. I'm happy to give you a COVID update at that time as well.
Good. We'll do
Just
that.
to put the perspective, but good to see that you've restricted the admission to the room because it is a tight room, for sure. And wearing masks when you feel that's appropriate is fully endorsed.
Well, we're the Health and Welfare Committee, so we try to
I know.
be somewhat cautious.
I'm with you, believe me.
That's good.
But yeah, so I mean,
Good.
prevention was the theme you raised, and that's it. Whether it's chronic disease, whether it's substance misuse, whether it's the development of a youth brain from nicotine to onward to opioids and stimulants,
ACEs,
whether it's
social determinants.
right,
Yeah.
whether it's early childhood programming that will actually set the mother-child or family-child dyad in a better direction from the very earliest days. All of those things are very high on our priority spectrum. And though it may not show up as much, obesity and childhood obesity being such critical problems, less in Vermont than elsewhere, but our trajectories are still all the same. That's something we have to tackle in the midst of everything else. And I know you have mental health coming in on my tail, but I don't want this committee to think that we are divorced from mental health. That's their turf. They have enough to do, by the way, in mental health, but the whole issue of integration of mental health is a council that I'm chairing with the Deputy Commissioner for DMH. The whole issue of how mental health and substance use disorders get addressed, isolated versus comprehensively. All of these are really big issues that our department is working on with them. Suicide prevention being the other really horrid statistic compared along with opioid overdoses. These are the realities, so they're all on the priorities.
And just to say, we will have you back, and the whole area of prevention is so difficult for people to understand when you look at appropriations and revenue.
Yes.
Because the longer term goals. So you don't see the results for many years, but it's so critical.
Right, but bravo to the last session where
Yes,
governor and legislature got together and $3 million appeared for really prevention coalitions around the state to have more equity in that arena that we've had. That is a longer term strategy, but caution you to realize that some of the returns occur within a couple of years.
Yeah.
So it doesn't mean you have to wait a decade every time you do a prevention.
so good. I'm gonna suggest that we move on to mental health. I know that there are about 1 million questions sitting around this table and on the screen. But we will look forward to having you back, and maybe we can talk a little bit about what you see as the topics that you'd like to
That'd be great.
present. I know we're gonna have bills. We're gonna.
We know you're gonna.
We're gonna see the tobacco bill back again and so on. So we know we'll hear that. We're gonna have substance use disorder, mental health. So, but we'll work together as much as we can.
Great. Well, thank you for having me today.
We greatly appreciate your time.
I'm sure most of you, but maybe not all of you, know David Englander, who is the senior policy and legal counsel for our department.
So David will not be a stranger.
I'm afraid not.
Oh, that's great. I
I
know.
apologize in advance.
Great. Thank you.
Thank you, Doug.
Sure.
Okay, yes. And thank you for, just thank you for your work.
Yeah. Sounds
Just
great.
before you leave. Oops, he didn't hear me. That's okay. I wanted to say thank you for. We're gonna take a 5-minute break. We're gonna be 15 minutes behind. That comes out of our hide.
We don't have to, I can just